Sylvia, back to you. Okay, we touched back together on few things regarding the I would say the barriers when it comes to accessing the quality specialty care. Now, expanding access to healthcare requires partnership. What types of local organizations, health insurance companies, or governments do you think are the key to scaling these healthcare solutions which MediPocket and UMG are bringing to Africa are needed?
Once again, let's organizations to partner. Yeah, I think the private health insurance companies, I think that we've started something with a couple here in Ghana, also government institutions, individual companies that are able to join in on this conversation, and also basically insurance companies works better because they already have their members and they are able to further help propagate the message that we're preaching about MediPocket, which we've started. Also, they will be able to help get the information to the right people, unless of course MediPocket decides that they want to be on the grounds themselves and be visible and have these conversations apart from the insurance companies. They can also partner. MediPocket can partner various companies or various companies and help out or be part of the social responsibilities by way of engaging in donations, trying to get the or create awareness of who MediPocket is and what they have for the country, and why there's a need for these private health insurance companies or government insurance companies or these institutions to be part of this MediPocket.
Great. No, I think definitely it has to be with partnerships to get into as many members, patients, and lives we can touch with, as you mentioned, the private insurance companies, the government organizations, the private organizations. Partnership would be key because I think solutions can be there. We can bring it, but the awareness, if people don't know why and what, they cannot utilize it. And that's why I think this awareness and partnerships are crucial. Now, I would like to also understand what are the current options available for patients in Africa currently who require specialized healthcare, and how do these compare to international standards?
Well, again, there are very few people on this list when you talk about medical, partnerships and all of that. Well, in Africa, these special care services, some can be considered as standard for international-like services, but we cannot boast of standing part to the international services. And so I can't tell you that we have those specialty hospitals here enough. So we still would need in Africa the services, if you can, from MediPocket or any other organizations that is able to get this on the ground for the people in Africa.
Understood. So currently people are just getting access to what is available. And there's really either they have to leave the country and go to the other country or completely go to the other continent in order to access the specialty care. But as of now, they are restricted on what is available. Also, standard wise, it is at, not every or most, or I would say not most of the hospitals and the institutes are of international standards. They still require that specialized, attention in order to make them up, or make them equipped to provide that international standard. Would you like to take this question?
Yes, I would. Yeah.
So let me ask you, Jerome, what are the current options available for patients in Africa who require specialized healthcare, and how do these compare to international standards?
The current option is right now is not as many, and in most cases, it's pretty much left to the patient. I would say to carry the load, and so if they have to travel outside, the patient in most cases would be the one that have to find a facility that they are going to and try to get in touch with that facility outside the country to be able to, get the care that they need. So a lot of the load is pretty much, with the patient to be able to find all these things, find it out, if they get there, where they're going to stay, and, things of that nature.
So they have to navigate the whole process if they are looking for care outside. And that's kind of overwhelming, especially when you have a sick family member, and as a caregiver or as a patient, if you have to navigate the whole around, the access part is actually overwhelming. And that's where at MediPocket we make sure, when it comes to international patients, to access the care abroad. So it's again important to learn from you that in ground, that's where the patients in Africa are facing, again, a little barrier and difficulty, where they have to do everything by themselves, as a patient or as a caregiver.
Right. And to add to that also too, it's also the option that is given usually is limited. It's just one facility that they have to go to, as opposed to be able to have, different options where they can weigh in on whether their full ability, the price, maybe they're able to travel there and things of that nature. So it kind of narrow it down to just one facility. For example, an insurance company may be in partner with, say, for example, a hospital, let's just say in India. And so that's where they would recommend that patients to go to. Now, regardless if the patient can afford to go there or, they don't have much of a choice, in that area. So they're just going to have to scramble and figure out how they're going to make that happen. And that was one of the attraction too that we have with MediPocket, that, we're being able to advocate for the patient, give them different options, so that it's not just one place that the patient have to go to. It's not just about sending the patient there to the hospital, but now the patient will have, options on maybe different hospital to go to, different places to travel to, and how to even get in touch with documentations and other things that they need to be able to go there. So just like you were saying earlier too, as I mentioned, it's a heavy load on the patient. So it's not very much of an option that the patient had in terms of getting the specialty care outside of the country.
Definitely, and I think that's important, and a very curated option should be provided, because I think that's one thing is, if they are only given one choice, then you feel restricted, right? And that's definitely one thing that at MediPocket we do, is we definitely match them to the right facilities and doctors, but there's always few options that are given, the curated options as we call it, for them. That brings me to another important question, which is, what role do technology, innovation, and partnerships like UMG and MediPocket play in this whole transformation, healthcare transformation that we are talking about?
I think they played a huge role. Technology as a whole, we know that technology is not advancing. There's so much um, when it comes to technology now in terms of healthcare. And the beauty of Africa right now is, we don't have to uh, go through the trial and error process of technology. Most of the technology now have already been proven in other countries. And so it's just a matter of adapting the proper one based on what is on the ground in Africa to be able to, give people access to these technologies. So technology, yeah, it plays a huge part in bridging the gap, as we mentioned, patient in a rural area, being able to have, to meet up and have a conversation with, the telemedicine with a expert outside of the country. So technology plays a huge part. And group like UMG, what we do is to be able to help bridge that gap, like find that technology through the partnerships. For example, like we partner with MediPocket that has specific expertise and technology and network that we can then connect them to businesses that are on the ground, institutions on the ground, like the government or corporations or insurance company that may not know about this technology there, and they in terms can be able to provide those to patients or their members um, to be able to take advantage of that. So that's where the technology come into play and the partnerships come into play to really be able to help those in Africa when it comes to healthcare. And like I said, the beauty there is, we can kind of cherry pick, these technologies, especially the one that works. We don't have to go through that process of trial and error, so to speak. A system that works, you can easily just collaborate partner-wise and then bring it to the continent.
Absolutely. And, as UMG is very diverse, and that brings a unique value, what UMG brings to any partner, especially, let's say, partners like MediPocket in healthcare. With UMG, it's good as a unique partner because you have other solutions, other partnerships that we can provide those solutions available. So that's one another important is like going in Africa, having UMG as a partner for any company that are looking to solve problems in Africa. It could be healthcare, it could be education, it could be technology, it could be, various other things. UMG could be one stop for them because you have partners around the world in various sectors, and then you make those connections, or as we call matching, as we call it here at MediPocket, matching to the right solution providers so that your solution can be efficiently brought to the region. So that's
Yes.
definitely very unique about UMG.
Yes, absolutely. So the partnership, as you mentioned, is on both sides of outside of Africa and also uh, in Africa as well too. So businesses that are also in Africa that need a capacity building, in terms of a partnership. Yes, we can also partner with them and link them to with the right uh, organization or businesses outside.
And that's amazing, I think people need that one stop unique partners. Um, um, Now, as a leader yourself, what advice would you give to healthcare leaders and organizations looking to make a meaningful impact on the African continent?
My advice to healthcare leaders is to, I would say, focus on sustainability solution. Now, like I said, not one shoe fits all. You have to know each person need to be able to address those things. To be able to leverage technology to improve access and to scale solutions, and also to be able to invest in building local capacity. And it can be done through training and development, awareness program, I would say. And lastly, to be patient and persistent. We're talking about Africa here. We all know that as real impact, it requires a long-term commitment and a continuous adaptation, right, to the evolving healthcare landscape that is in Africa.
Yeah, patience is a key, but especially when you're working on a larger solution, and in the regions, Africa, where it requires sometimes the government involvement or the public sector involvement. So, but it's been an absolute pleasure having you both on the show today. Thank you so much for sharing your insights on the current healthcare system in Africa and the ways we can work together to make specialized care more sustainable and accessible for patients there. I'm truly inspired by your work, Jerome, with UMG, and Becky being a partner of UMG and at MediPocket